Hi everyone, I'm back again. Dr. Shabnam, Breast and Colorectal Cancer Surgeon from Apollo Hospitals, Bangalore. As you know, we are running this Pink of the Health series, so it is in continuation with the same series. Today I'll be briefing you about the colorectal cancers. Now, what is colorectal cancer? It is any cancer that can happen in the large intestines from the place that it joins the small intestine up to the back passage. Why we're discussing this is because if we look into the data that we have got recently from the ICMR, which is the Indian Council of Medical Research and Sciences, it says that Bangalore is becoming the hub and it is having the highest number of the colorectal cancers in men in India. And if we look at the incidences, it is 4.5, between 4.5 to 5 per lakh, but then if we know the population that we have in the country, right? So if we convert it into the exact numbers, then we're having anything to the tune of 65,000 new colorectal cancer cases in a year, annually in our country only. Now, why is it important to discuss this cancer? Because it is one of those cancers wherein the signs and symptoms are so very subtle that you might not understand that you're harboring this cancer till months together, like 15 months, 16 months, a year and so. And the second most important thing is it is one of those few GI cancers wherein if it is even stage 4, we are still able to provide you a lot of help and increase the overall survival of the patients. So who are the people who are at higher risk of having this cancer? That would be the first question coming to mind. So as we know that the risk of majority of the cancers increases with the age. So whenever we cross 50, the risk for this cancer also starts increasing. So 50 is the cutoff when we should actually start our screening. That could be fecal occult blood, or it could be like your stool test, or it could be colonoscopy, or at least an examination, the digital examination by a trained surgeon or a colorectal surgeon. Who are the other high-risk people for this? Anyone who has had a family history of colorectal cancers, anyone in the family, either first degree or second degree, or people who have had what we call inflammatory bowel disease, that is either Crohn's disease or ulcerative colitis. People who have had long-standing irritable bowel syndrome or IBS, what we call. Then people who have had clustering of the cancers in the family. Now, what we call clustering of the cancers in family, that doesn't necessarily have to be colonic cancers only. So you could be harboring what we call Lynch syndrome or HNPCC. So in that, you will have clustering of the cancers from either your maternal side or paternal side, first degree or second degree relatives. So you'll have at least a few of these cancers recurring in the family. Which could include the breast cancer, the ovarian cancer, the uterine cancer, the colorectal cancer, and the prostatic cancer. So if you have any such history, you have one or more people involved in your family, please do get evaluated because you could be amongst that high-risk group. Now, recent studies also show that long-standing diabetes mellitus type 2 is also increasing risk of the patients for having colorectal cancers. It is an immune-derived cancer. So we have seen that people who are having any kind of immunomodulation, for example, we are having transplant patients, especially the renal transplant or kidney transplant patients. In that subcategory also, we have seen that there is a bit of increased risk of having colorectal cancers in the long run. We have patients who have received radiation therapy in the lower abdomen, or what we call pelvic area. For example, for cervical cancers in women or prostatic cancers in men. They could also in the long run be harboring this cancer. So they are at the higher risk group. This again constitutes the high risk group. Or patients who are having HIV also, they are also having a higher risk of having various cancers, and colorectal cancer is one of them. Now there is also some latest these studies and trials and the data coming up that says that increased BMI. So your increased weight also contributes to the higher risk of certain cancers, and colorectal cancer is one of them. Then vitamin D, as simple as that. Like vitamin D, we don't have any level 1 evidence for that, but then still there is data that suggests that the maintained levels of the vitamin D can give you some protection. So if you fall into that category wherein your vitamin D level is lower, you could be having, that could be adding to your risk of having colorectal cancers. So these are the high risk groups. Now the second question that usually people would ask would be, what are the signs and symptoms? How do we know that we could be harboring this or we should seek help? As we have also discussed earlier on when we gave the overview of what we are going to be discussing in these series. So it could be as subtle as a subtle change in your bowel habits, structural bowel habits. You have crossed your 40 or 45 years of the age and your bowel habits were different. You used to pass stools only once in the morning and now all of a sudden you feel that you have to go to toilet twice or the consistency is changing. That could be a sign. If you cross 40-45, don't take it lightly. If it has stayed there for more than 1 week, 10 days. We don't mean that every slight change in the bowel habit is going to be because of the colorectal cancers. It could be infective, it could be inflammatory, it could be anything. But if you are in that age group, if you have any of the high risk features and if these changes have stayed there for more than a week, then it's better to get evaluated by a specialist. Similarly, if you are having normal bowel habits and now you all of a sudden started getting constipated, or maybe you're just having blood in the stools. There are so many people that we see that blood in the stools or any mass in that region, they think that it's just hemorrhoid or piles and taken for granted and treated without evaluating. Please try and understand if you are in 45 years of age group or 50 or beyond that, and these changes have started all of a sudden now, then please at least get a flexible sigmoidoscopy done to rule out that there is no cancer which is causing this symptom. Not every hemorrhoid is going to be because of the cancer, but hemorrhoids could be one of the presentation of the colorectal cancers, especially the rectal cancers. So you have to stay alert to these signs and symptoms. So similarly, all of a sudden you're feeling that you started getting weak, you started losing weight, there is lack of energy. That could be one of subtle signs of these cancers. We have seen a lot of people going around and seeking help from the physicians, taking blood transfusions, taking iron, and for months together not getting evaluated for this. On the right hand side of the colon, we have the right side of large intestine, the left side of the large intestine, and a segment joining the two, which we call transverse colon. So the right-sided growths might just, present with anemia, a low hemoglobin or low blood. Right? So you might not know that you're harboring these. There could be some subtle signs which people take as gastritis, gastric problems, and do some self-medications for that and don't get evaluated for the actual cause. So these are the signs and symptoms. How would you get evaluated? We have various methods. You can send your stool for occult blood. So we assess under the microscope and see whether your stool is having any traces of the blood, or you have overt blood. You have those signs and symptoms and you tell us that you're having blood in the stools and mixed with the stools. The second thing is we are having some immunological tests in the stools, because occult blood is a bit of cumbersome procedure. So you have to wear your stool for 3 days continuously, and then you have to restrict diet, you have to restrict your iron intake. So to help that, we have another test also which is called FIT. So it's an immune based test in the stool itself. Or we can have flexible sigmoidoscopies or colonoscopies. They are small tubes. I'm sure majority of the people out there are well versed with the term endoscopy. So this is exactly that. But we put the endoscope or the small tube with the camera through your back passage, and we examine the whole of the colon and see whether we have any subtle changes therein. Why is it important? Because 9 out of every 10 colorectal cancers is preventable, and that's a pretty good number. 90% are preventable. So there is a basic phenomenon what we call adenoma carcinoma sequence. What happens is that it starts with those small polyps which are absolutely benign, and over the period of time it might change into the carcinoma or cancer. So if you pick them up at the smaller stage, at a benign stage, we can just remove that endoscopically with the help of the colonoscope and be done with it, and you're saved of the bigger procedures and the rest of the treatments associated with the full-fledged cancers. So this is the importance of all this. Once diagnosed, we have different modalities. We can have chemotherapy, we can have radiation therapy, but surgery usually remains the mainstay of the treatment for colorectal cancers. And the other thing that you have to understand is that stage 4 cancer just doesn't mean that you have been sentenced with that death sentence, or it shouldn't sound like that. We are having various categories of that as well. Even in stage 4, there's a stage what we call oligometastasis. So that means it is stage 4, but the spread outside that organ is very limited. So we have a lot of stuff in our armamentarium, and we can help you out with that and give you good overall survival. Please stay safe, stay alert to these signs and symptoms, understand your body, and live a very healthy life. Stay in pink of your health. Thank you.